Hey guys, this is Dr. Herb. In case you haven't subscribed, please do subscribe for updates. Let's compare the arsenic poisoning. The arsenic poisoning, we are going to look at in case of arsenic, the acute and the chronic. So now let's look at what is acute. So in case of acute arsenic poisoning, it is delayed hair loss. So in case of acute, there's delayed hair loss. And looking at chronic, it is the melanosis, Bowen's disease. So it is associated with the chronic. If you see, it is associated with the Bowen's disease. There is edema, hyperkeratosis, cutaneous cancer. There is a Bowen's disease, there is cutaneous cancer, as well as the hyperpigmentation. Now let's look at the nails. Nails, both of them have a common, that is the Meals lines are present. And neurological, acute can present with hyperpyrexia and convulsions and tremors and coma. So there is, in case of acute, there is going to be the hyperpyrexia as well as convulsions and tremors. Next, let's look at the chronic. What is present in chronic? In chronic, it will be the encephalopathy, polyneuropathy, as well as the axonal degeneration. Next is the GI. So in case of GI, the acute will present as the abdominal pain, dysphagia, vomiting, bloody or watery diarrhea, and mucosal erosions. So there's going to be prominent bloody or the rice water diarrhea. Next is we look at the chronic. In case of chronic, it will be the nausea, vomiting, diarrhea, as well as anorexia and a significant weight loss. So the liver, in case of acute, will be the fatty infiltration. In case of the chronic, it will present as the hepatomegaly, jaundice, as well as there is cirrhosis as well. Now let's talk about the kidney. The kidney, it presents with the tubular as well as the glomerular changes. There is oliguria and the uremia. So there's tubular as well as the glomerular changes, and this is with respect to the acute. Whereas in case of chronic, it is going to be the nephritic findings. Now, what about the hematological? Hematological, the acute will be the thrombocytopenia, the impaired folate metabolism. So impaired folate metabolism is seen in case of the acute. Whereas in case of chronic, it is going to be the bone marrow hyperplasia, the anemia, leukopenia, basophilic stippling, as well as the karyoexis. So in case of chronic, it will be the basophilic stippling, the karyoexis, the bone marrow hyperplasia. This is all in case of chronic. Next, let's look at cardiovascular. In cardiovascular acute, the heart will show ST wave abnormalities, prolonged QT interval. So CVS, this is important. In case of acute, what is it? In case of acute, the heart will show ST wave abnormalities, as well as there is a prolonged QT interval, QT prolongation, and there is a prolonged QT interval. Next, there is a ventricular fibrillation. There can be atypical ventricular tachycardias. They can be with humeric acid. Next is the southwest coast, in case of Taiwan. Next is the Blackfoot disease. This is in case of chronic. So in chronic, it is associated with the Blackfoot disease due to the platelet activation and the hypercoagulability of the blood in peripheral arteries. So Blackfoot disease. In case of chronic, it is associated with the Blackfoot disease. Next, moving on to the reproductive system. So here in reproductive system, it is in case of acute, it will be the maternal ingestion of inorganic, and arsenic crosses the placental barrier and the infant death shortly after the birth. So it can cross the placental barrier and can cause the death. To learn and grow daily like this, please do subscribe.